Hey y'all, Dr. D here. As I shared with you previously, I work with a variety of different patients with a variety of different issues. And one issue that many patients that I see have is autism spectrum disorder. And if some old terms that you may have heard was things like autism and Asperger's. What research has shown over time is that those two disorders were connected, and they see are the behaviors that are demonstrated in an individual that have that disorder ranges on a spectrum. And so you may hear someone say they know someone on the spectrum. Oftentimes people think people with autism are mentally retarded. First and foremost, we don't even use that term anymore. For individuals that were mentally retarded, we call them intellectually disabled or developmentally disabled regarding their intellect. Just because someone is on the spectrum does not mean that they have intellectual disabilities, although they can. But if we go back to the thought process of individuals on the spectrum, those that have Asperger's per se on this end of the spectrum, and then those with much more severe symptoms on this end. So Asperger's looked like, and still does, although now that it's on the spectrum, maybe an individual that probably normal society, for lack of a better term, goes on, and you really can't tell unless you are very close to the person, or you may just notice some odd behaviors. One of the challenges that people on the spectrum have is with interaction and communication with others. They speak just like you and I speak, but subtle conversations like innuendos and things like that, they don't necessarily pick up on. They may say things that are socially awkward. If you may ask, how do you look in that dress, for example, they may say, oh, the dress is really ugly, or I don't really like you in that dress. Whereas socially, we've been taught to be very polite and say, oh, well, I kind of like the other dress better. And so in relationships, it creates some difficulties for adults. It especially creates difficulties for children who are on the spectrum as they try to fit in with their peer group, because they can't pick up on subtle cues. And so how they are treated in therapy, you teach them behavioral skills, social skills, in order to help them to interact and to learn different social cues. You also teach their teachers, their family members, how to communicate with them. So rather than saying, it would be nice if you cleaned your room, your mother or your father would, if you were a parent, you would tell the child, go clean your room. And then the child would likely comply with your request because of those subtle types of communication barriers. Other things that people on the spectrum may have challenges with are sensory things. So certain lights, certain sounds, certain feelings, like maybe the tag on the back of their shirt, the certain materials and clothes, light flickering, those things can bother them. They also have a difficult time changing their routine. They like things very concrete, and so changes in their routine can make them become very irritable and frustrated and confused, because a lot of things they see in what we call black and white. So if you're supposed to eat dinner at 4:30, at 4:35, a child may become very frustrated, or your partner, if you're 1 or 2 minutes late for dinner, because they are creatures of habit, if you will. Some other challenges that they also may have may be expressing their feelings. Like I said, communicating with individuals is a challenge for them. So you may ask them how they feel, because over time they've learned the basic types of communication. They may say things like fine, I'm doing fine, everything's okay. But in a relationship, for example, in couples that I've counseled where one of the individuals is on the spectrum, oftentimes the other partner explains that, he never explains his feelings, or she never talks about how she feels, or, she always seems emotionally distant, or he always seems emotionally distant. And what they are communicating to me is that their partner has a difficult time communicating and expressing themselves. And so we work in therapy to help this partner to understand the challenge that their husband or wife may have, and then this partner to understand ways that they can communicate and initiate sharing their feelings. Sometimes that could be with using a movie or a book or a story that expresses how they feel when they themselves may have a difficult time expressing those feelings. So just wanted to share that with you because there's a lot of misconceptions about people that come to therapy. Everyone assumes that if you come to therapy, you must be retarded or you're crazy. Those are just labels that people throw out because of their ignorance. And so I want to help educate you to help you understand more about mental health. If you need mental health services, please click the link in the bio, or if you know someone that could benefit from these services, please share this post and or share my website. All right, thanks. Go crush your day.